Time now for more health. Now, last week we shared the surprising study that sperm counts in men are down by, get this, 59%. So if you have a moment, folks, please stop and listen, especially if you plan on starting a family and you're having issues. We wanted to understand a little bit more about this study. So joining us now is Dr. Carrie Bedient of the Fertility Center of Las Vegas. Dr. Bedient, thank you so much for being here. How you doing?
Fine, thank you. It's my pleasure to be here.
Oh, we are so interested in this study, so I'm going to get right down to the specifics. Again, if there's anybody out there who's trying to have a family and you're struggling, this is for you. So we hear a whole bunch about couples, doctors struggling to have kids. Then women, of course, they're forced through the painful process of injections and procedures. But could the problem actually be men that you've seen in your practice as well?
Yes, about 20% of infertility in couples is due solely to male factors, and then there's about another 30% that's contributing from male factors. And so it's about 50% of couples that have difficulty conceiving that there's some influence of the man, because everybody forgets that it takes two.
Yeah, absolutely. Okay, so how can a man get his sperm count tested?
So at the Fertility Center, we have what we call semen analysis mini review appointments. And so men come in, they give not only a semen sample where we look at the count, the percent that are moving, and the percent that have a normal appearance, but we also sit down and go through their medical history, because what most people don't realize is that sperm is a barometer of the health in general. And so if there are other medical issues going on, that can lead to a lower count.
Okay, and speaking of extra things going on, the study suggested that exposure to certain chemicals could play a role as they can harm male reproductive systems. Address that.
So one of the most common chemicals that people forget about is testosterone, and testosterone supplementation is really on the rise. And the way that testosterone works is that it knocks out sperm production when you're taking it in medication form. And many people don't know that. And so there's also other chemicals that occur that we see in plastics and environmentally that can have an impact as well. But
we've done a lot of stories about the plastics and how they're really harming us more so than helping us.
More than we know.
Yeah, yeah. Okay, so what are some of the other factors that could impact sperm count? I think we're going to list those on the screen here for you.
So exposure to chemicals is one, diet, smoking, your body mass index, so overall weight as compared to height has a huge impact, obesity, general health status. All of those things make an impact.
Yeah, and you know, we did a story, speaking of your health, we did a story this morning on the 7 to 9 talking about how even your oral health can affect your overall health. Yeah.
That's very true.
So in your office, I can't imagine the emotional impact that this kind of problem has on couples. What do you do? How do you advise them?
So mainly encourage them to embrace the emotions. It's very stressful. There have actually been studies done that show that infertility diagnosis is as stressful as cancer in a very different way. But it's something where I encourage my patients to talk to each other, talk to their friends, see a counselor if they need to, and then also there's the emotional support that our staff provide as well, because we know that this is horrible. Nobody wants to be in my office, so we try and make that as efficient and supportive an environment as we can.
As possible. Thank you so much for addressing this. We appreciate that. And I know last time you were here, you were pregnant. You got a 9-month-old now, right?
Yep.
Congratulations to you.
Thank you.
All right, folks, hopefully that helped.